Okay, so I'll ask you, what did you come in to see Dr. Levy for, and how long ago?
I have diagnosed with a degenerated hip about 19 months ago, and came in to see Doc in September of 2014.
And what medications were you taking then? Were you taking a lot of pain medicines?
Yes, I was on hydrocodone, Tylenol with codeines. I mean, it just went on and on. The pain had gotten so bad. I kept procrastinating. I'd never been hospitalized for anything before, so kept putting it off, and Doc scheduled me for December 22nd.
Okay.
But for obvious reasons, we didn't get in on the 22nd, and I got in on the 12th of January 2015.
Okay.
So I'm actually one day past the start of my 3rd month since surgery.
Okay. And before you had the hip done, how debilitating was it?
It got to the point where I was actually slithering around. It was like a dead limb. I mean, the pain level, when they would ask me, I triple or quadruple it. That's how bad it was. I mean, I couldn't put my shoes on, my socks. I was having a hard time. I had to have the kids help me put on my clothes sometimes, and even problems going to the bathroom, sitting down. I mean, it was just outrageous, and the pain was so bad it actually pushed me, and the doc convinced me too. I was really intimidated to have the surgery. Never been in the hospital for anything.
Right.
So
the day of surgery, you were nervous, but
and I mean, even in the waiting room, that it seemed to be taking too long, and I was already starting to say, you know what, I want to change my mind. I don't want to have the surgery, and but I guess they got me in there pretty quick, and the moment I woke up after anesthesia, even though I was under the spell of anesthesia, I could just tell the difference immediately. I just knew right away, and my wife said that I looked like a pregnant woman. I had this glow around me. So and it's been nothing but sunshine since.
So what's the first day that you walked?
That very day.
The very day you had surgery?
That very day, and it was more out of anger because of the catheter. I wasn't comfortable with it. I didn't like it, and I was pretty cranky maybe that first day. But from that point on, I mean, I was just so appreciative of I could tell the difference, the big difference.
Did you have to take a lot of pain medications in the hospital?
Well, while I was in the hospital, you have what I call the residual effects of, I play a lot of sports. I experienced it with, when we would slide into a base and you get strawberry, but it felt like really raw on the inside, but nothing compared to what I had been suffering before. So it was something that I could deal with, and I could tell every day it was getting better and better and better. So.
And how long did you do physical therapy?
6 weeks, once a week. Doc released me day before yesterday. I made 4 of the 6 visits, but I was actually doing more than what I was doing in therapy, and I was already up to 3 miles a day.
And I can't even tell which hip we did, so
yeah,
tell them which hip we did.
Here. Yeah, and I mean, I'm running now. I can jump, which is something I couldn't do for a long time. I'm a little leery of it because of the impacting and everything, but I'm doing everything I was doing before I experienced this bad hip. So
let's see, stand up. Let's see, we'll have you lift your leg up.
Well, yeah, I can lift my leg. Look at this. I couldn't do this Christmas Eve. I couldn't do any of this. As a matter of fact, couldn't do none of this, nothing. I couldn't do this. I couldn't jump. I couldn't do this.
Can you bend over and touch your toes?
Oh, well, I got long arms, so I was doing that even after surgery. But my hands almost touched my, I mean, I could run. I mean, I can balance myself. I can pull up on this is the leg I had the surgery on. I mean, it's just outrageous. Things that I know that I couldn't do before. I mean, taking my shoes off and on, being able to cross my leg so that I can change and put my socks and stuff on. I couldn't do this before. I couldn't even put this leg on top of this leg. That's how much it hurted, just that little bit of weight. But I mean, I can do it all. Like it says, it's just, the only word I keep using is outrageous. what the surgery has done for me, and
That's great.
it's
And
good.
what pain medications are you taking now?
Nothing right now. I'm done with them. And I don't, the wife and the kids, a lot of them were concerned, but I mean, it had gotten to a point where I just wasn't enough medicine to stop the pain. So I actually maybe about 3 weeks ago, maybe an approximate here and there, but other than blood pressure medication I'm not taking any pain medicine at all.
Excellent.
He did give me some tramadols, but I'm not even taking those. I just have them just in case. I just have some soreness, residuals, a little bit of numbness here.
What kind of exercises are you doing?
Well, I'm doing a lot of walking. There's 20 flights of stairs up and down from where I live, so I mean, I do that maybe 3-4 times a day. Family owns a business, a funeral home, so I'm up and down a lot. So I do a little bit of weightlifting, just nothing heavy, just to tone. I'm already noticing my calf muscle starting to straighten up, like the left side. So.
And you said you were bicycling, or?
Yeah, did well. I haven't gone on the street, but I mean on the stationary. But 20 miles an hour. I've had it up to 20 miles an hour. I've done about 5 miles. I got a pedometer on the phone, so it keeps track of my walking. So the day the doc released me Wednesday, I walked from the clinic on Division and Western to where I live, which is almost 5 miles.
That's great.
So bought me a big shake. I lost a lot of weight. I went from like 225 to 182 pounds.
Wow.
And I'm back up to 195 now. And
was it just because you were moving?
Well, it was more so I was just so depressed. I didn't even want to eat. I was drinking a lot of coffee, and I had lost my appetite.
Was this before the surgery?
Before the surgery.
Okay.
And from day one at the hospital, ordering food, I mean, every day. And I've just been on a controlled binge since, but watching what I'm eating. But I put on about 14 pounds, 15 pounds. I'm looking 205, 210 for the summer because I work out a lot. So.
Okay. So what would you say to somebody who?
I would definitely encourage it, and especially sometimes pain will dictate. You just know that there's nothing else you can do, no other medication you can take. So for quality of life, I'm going to be 59 this year, and I was intimidated by it. I didn't want to do it at first, and kept pushing it off till the leg says, hey, I'm not doing any good for you anymore, and so I had the surgery, and I'll attest to it. I mean, I can't, in some cases, can't even believe. I'm wondering, something gonna happen later. I'm dreaming, but it's just like I said, it's just amazing that.
And how's your scar look?
The scar looks really good, and I tell this. I don't know if they want it on camera, but family owns a funeral home, and I've been doing stitches since I was 14 years old, especially autopsy patients, and they did a really nice job. So it's not that noticeable. It was invasive right here in the front. I mean, that's just. I've talked to other people that have had the surgery on the side or the back, and what they went through, and that's what kind of intimidated me before the surgery. But no, I'll attest to it now. I tell them, do it if you're in pain. I've been telling people that sooner or later, I'm not one to like to take medication if I don't have to. I like to do a lot of things naturally, but if you don't want to be taking medicine the rest of your life, I tell them, do the operation. I took the chance, and I take it again.
Excellent.
I can't say enough about it. Like I said, I couldn't do this. I couldn't sit on the edge of. I had to most of the time. The last several months was move my leg around one way or another, so I could drive. Couldn't drive comfortably. I'm driving again. Like I said, I'm doing.
Great. That's excellent. Well, we'll have you show you walking, and.
You run.
Yeah, we'll have you run down the hallway.
I don't want to run too fast.
No, we don't want you.
Cut the carpet too much,
All right. Let's see.
It says I mean, the little bit of Olympics because of the shortage of blood. I couldn't run.
I heard months ago. Couldn't do that. Couldn't do it at all.
That's great.
Couldn't twist. Yes, I couldn't do this.
That's excellent.
Couldn't, well, definitely couldn't do that. Definitely couldn't do this. I think it's trying to get my balance a little bit, but I've always had that. So I will blame that on the hip. But the fact that I'm able to move it around, it's just outrageous. And then the best part is I couldn't do it originally, but the last couple of days I've been able to, and that's sharp. I couldn't do this before. Even a couple of weeks after surgery, the impact bothers me. But doesn't anymore. Like I said, other than maybe a little bit of soreness when I feel in the calves and my thighs. Very great.
Thank you
For everything. Doctor.